welcome everyone on behalf of the Learning Institute at Millersville University. Every month we host different events, educational events that we use to promote social change and to foster a willingness to promote human rights as well. So today we'll be talking about access to childcare as a part of our policy advocacy webinar series. So as you see, we have a great group of people who will be joining us for this conversation. This is a webinar, but we want you to be as engaged and interactive as possible. If you have questions throughout this webinar, please feel free to type them into the Q&A feature. We'll have a special time at the end to address the questions, but feel free to add them as they come up throughout this time. And I will begin by welcoming our moderator for the event, Dr. Jennifer Burke. Dr. Jennifer Burke is an assistant professor of early, middle, and exceptional education at Millersville University. She's currently the chair for the President's Commission on the Status of Women at Millersville as well. Her research focuses on teaching young children about racial and gender stereotypes. She is also the author of a titled I Think He Is a She, First Grade Students Grapple with the Gender Binary while reading a transgender picture book, published in Pedagogies in the Flesh, Case Studies on the Embodiment of Social-Cultural Differences in Education. So I will take this time to hand things over to Dr. Burke, but if you have any questions, I'm also available in the chat.
Thank you. So 2.5 million women. That's the number of women as of last month who were reported to have left the workforce as a result of the pandemic. And we can only assume that some of that is from issues of care, needing to provide care for sick family members or children. And compare that to just 1.8 million men. The numbers of both are staggering, but the disproportionality is definitely something that I am passionate about addressing. But it's not just the pandemic. Childcare has long been an issue in this country. And so I'm really excited to welcome this group of panelists today to share their thoughts on exactly what is the state of access to childcare currently. Today we have many individuals that I would like to introduce. I'd like to start with Amanda Burns. Amanda is the Education and Child Development Impact Team Leader for the Community Action Partnership of Lancaster County. She leads birth through 5 initiatives across the county to increase access to high quality care through publicly funded programs, resources, and subsidies to support child caregivers in their journey towards economic prosperity. Within the Education Impact Team, CAP provides prenatal to 3rd grade United Way Collective Impact Grants that partners with several communities to align early childhood education and early childhood elementary grades. The P3, now known as the First 10 movement, is deeply embedded within CAP's educational programming, such as the Parents as Teachers and the Thrive to 5, where over 1,000 children and caregivers are supported through birth through 5 programming and home visiting opportunities. Amanda has a teaching certificate from Millersville University, principal certification from California University of Pennsylvania, and a master's in curriculum and instruction. She has taught for Manheim Central High School District for several years before becoming the early childhood liaison, where she became passionate about serving under-resourced families and increasing the quality and access to early education services. So welcome. We also have Jen DeBell. Jen has more than 20 years of experience in state government and nonprofit organizations, focusing on public policy and advocacy for children and families in Pennsylvania. She is responsible for providing effective leadership and management of the Penn AEYC as a leader in the Start Strong PA and Pre-K for PA nonpartisan advocacy campaigns. She serves as the co-chair of the Early Learning PA Coalition. She also serves in the state government as policy director and legislative director of the PA Department of Human Services and as the special assistant to the deputy secretary of the Office of Childcare and Early Learning. These are mouthfuls. She also works for the PA Partnership for Children, a nonprofit, nonpartisan children's advocacy organization, and began her career as a legislative assistant to the former Senator Allison Y. Schwartz. She holds a bachelor's degree in political science from Susquehanna University and and the certified nonprofit professional credentials. Originally from Delaware County, she lives in Hummelstown with her husband, 2 children, and 2 labs. So welcome. Even more panelists, this is so exciting today. Andrea Eberlin is the executive director of the Pennsylvania Early Learning Investment Commission. The commission was created by an executive order in 2008 for the purpose of mobilizing business leaders across Pennsylvania to secure support for investments in early learning. Before joining the Pennsylvania Early Learning Investment Commission, Andrea served as the Vice President of Strategic Impact for the United Way of Lancaster County, where she helped to lead and support community initiatives focused on improving the education, health, and financial outcomes for children, youth, and adults. Under her leadership, United Way of Lancaster County was recognized nationally and statewide for unprecedented increases in health and social service collaboration and innovative place-based strategies related to social determinants of health. Andrea has an extensive background and experience around community building work, service coordination for adults with disabilities, community systems, development for children with disabilities, and directing an employer-sponsored NACE-accredited early childhood learning center for PA Medicine / Lancaster General Health and Franklin Marshall College. She currently serves on the governance committee for the Lancaster County Homelessness Coalition and the advisory council for the Nurse Family Partnership. She received her master's of social work from Millersville University, where she's now an adjunct professor and teaches undergraduate and graduate coursework in social work classes. She is a 2018 Policy Fellow alumnus from the Pennsylvania Office of Child Development and Early Learning, and a 2019 graduate of the United Way Worldwide Leadership Program. Welcome, Andrea. And our final panelist, Rebecca Lang. Rebecca Lang is a former managing editor of the San Francisco Bay Area Moms, a digital publication that is part of the City Moms Collective. She graduated from Penn State in 2005 with a master's in labor relations and human resources. Over her career, Rebecca has held a variety of roles in human resources for 2 Fortune 500 companies, serving as a business partner and a change management consultant for corporations and manufacturing facilities, international locations, and business acquisitions. After the birth of her first child, she surprised everyone, including herself, and left her job to stay at home with her daughter. During this time, Rebecca began writing and editing for online parenting publications. In January 2020, she rejoined the workforce for Clorox Company as the employee relations and change management consultant, and recently stepped back again out of the workforce to support her children's distant learning during the pandemic. So thank you so much for coming here today. Such wide array of experiences, so many relating to specifically childcare and providing the best possible services. Many of us are moms. I have 4 children myself. And so I think we have a lot of rich room for conversation here. So to go ahead and begin, the first question I would like to throw out to the panel is, what issues with access to childcare existed before the pandemic, but have been exacerbated by the pandemic? And we're going to keep this informal, so if you just want to go ahead and unmute yourself and go ahead and share.
So I'd be happy to kick it off. So from my perspective, one of the biggest barriers is definitely the cost. For any of the parents joining us, and I'm one of them, childcare rivals your mortgage, your rent, even college tuition if you have 2 children in care. And, you know, when you think about the kids in care, most parents are having children at a young age, early in their careers, you know, when they're trying to make ends meet themselves. And certainly that's been something exacerbated by the pandemic when you think about all of the people's various employment situations and what people have been dealing with economically, you know, individually as families. So we do have a program in Pennsylvania, the Child Care Subsidy Program. It's called Childcare Works, which helps low-income families afford childcare. And it's aligned with families' work schedules. but historically, we've never had enough money to fund all eligible children. And, that's something that as we pull out of the pandemic, we're really concerned about. We know as people get vaccinated, more and more parents are going to be going back to work, and we want to make sure those low-income families that are eligible do have the access to the subsidy so that they can get their child in a safe, quality arrangement, and they can go back to work with peace of mind.
Yeah, and I'm glad that Jen kicked this off, because absolutely, we know there's multiple studies that show that prior to the pandemic, access, affordability, quality childcare, these were really significant issues. And, something I'll probably talk about a little bit later in our presentation, they have a real economic impact on families, businesses, the economy. But we know that the pandemic just exacerbated. We have Jen, now like over 500 centers that have permanently closed. We have 400 that are temporarily closed. So as businesses start to rebuild and families are going back to work, there can be a real struggle. So it is absolutely timely that you are posing this question today.
I'll second that. I'm based in San Francisco, and cost is an issue here for pretty much everything. It's a very expensive place to be, which means that childcare as well is that much more expensive. But there's also the huge supply and demand issue. So as an example, when I was looking at childcare before I decided to stay home with my kids, I was number 64 on the waiting list, because particularly for infant care, the ratio of caregivers to babies just makes it that the opportunities are just that much less to have your child taken care of in a safe place and an affordable place as well.
Yeah, I think I have a statistic here that in 2019, infant care in Pennsylvania was about $11,560, which is about 46% of the annual income of a single mother in Pennsylvania. So you're right, it's staggering, but ironic, because it's only a fraction of what it truly costs to provide quality care. And I'm sure we'll get into that too.
Yeah, and the only thing that I would add to Andrea's point about those that have closed and those who are temporarily closed in the state, and that's really great data to kind of monitor and keep an eye out. But in our counties across the state, looking at the access is also as the numbers of centers that don't reopen, we aren't going to have options. And I think that goes to many of the points that were made today, is that we didn't have a lot of options, to meet the demand. And now even more, we're going to see that decrease. And so it's even more to pay more attention and support with funding so that we can reopen and have those quality care centers open again.
And I'll add, as of, I think this is fall 2020 data, only 42% of our childcare supply in Pennsylvania met high quality standards. So, both Andrea and Amanda have alluded to this, like with the closures, this is something, we're watching all programs, but particularly the high quality ones, we don't want to further restrict access to something we're trying to grow.
Yeah, and I know that there's funding for Head Start at the state level, pre-K counts, and I think all that is great, but with the pandemic, we have to have in mind that we're gonna, for folks who are becoming unemployed or not sure if they're going to go back in the same profession, we might have more, and I think this goes with the subsidy piece you talked about, Jen, is that we're gonna have more people that are gonna qualify for these services that we're not gonna have the funding to provide.
So many important issues just were thrown out to discuss. So we can take this in a lot of different directions, but I would like to start first with the idea of the funding. So I think that would be something that we would need to think about on several different levels. What do you see as some of the obstacles related to funding when it comes to getting childcare for children?
So I will say one positive out of the pandemic for childcare is, I think, all of us who are advocates talk about the benefit for the child, in brain development, healthy development, school success. But I think the pandemic has really just made it clear that parents need childcare to work, and it's an economic driver. And I'm sorry, your specific question, I kind of lost my train of thought there.
Oh, no, I think that was important.
The funding.
The funding, I'm curious about the funding.
So we were very fortunate, Advocacy Nationwide really pushed for, it was a $50 billion ask at the federal level because states' economies weren't in a place to be able to add to state budgets this year. So with the new American Rescue Plan, there's actually $40 billion that's going to be driven out nationwide for childcare. There was another 10 that was included in a stimulus package in December, and Pennsylvania is poised to get over $1 billion. And so while some funding is considered one time, other pieces are permanent, this is a really big opportunity to think through how we re-envision our childcare system. It was broken before. And it was just kind of cobbled together year to year with, funding asks. This is the time to start thinking through, Amanda, your point about pre-K and Head Start. Those programs are funded very differently. They receive an annual budget from the state per child. That state helps stabilize programs. That's not how childcare is funded in most cases. So we do have a good opportunity on our hands with the federal funds. It's how it's used and how visionary we can be moving forward.
I would say I'm so excited to hear that. I would say just in general pre-pandemic, and I'll be curious of how it really does change in the pandemic. I think one of the biggest obstacles is just culturally in America, having kids is still seen as a very personal choice. Even though sometimes we talk a good game about it taking a village to do it, no one actually seems to want to invest in that village to make it happen. So it seems like there's a real big opportunity, but even within the workplace, you've got lots of working parents, companies want to support them, but you also have people that don't have those responsibilities at home, and making sure that both populations feel supported and like one isn't getting preferential treatment over another, it is an interesting thing and can sometimes breed resentment from, as I've heard, non-breeders.
And I think that's a really important point, Rebecca, that you bring up. And I think, as Jen mentioned, the conversation around childcare is really being elevated. And when we can really start communicating that quality childcare is quality early learning, and that it's a 2-generation workforce issue, that we're preparing the workforce, of today, we're supporting the workforce of today so parents can work, but also preparing a successful workforce for tomorrow. And we're so fortunate to have those longitudinal studies that support that, and to demonstrate that when children have access to high quality early learning, there's so many positive outcomes that eventually you're going to have, somebody who's well positioned to be a contributing member of society. And then hopefully some of that us versus them isn't, so prevalent in the workplace. We can cross our fingers.
Yeah, and I think there's a lot of hope, with the relief bill. But like Jen said, it's only temporary. We don't know, but I am hopeful with new legislation that there are, long-term plans that we can think about with the childcare tax credit, versus non-refundable, refundable, as well as like universal pre-K, and what that could do, I think, for childcare, or early learning in general, especially for those who are in the private, sector, because you're right, there are some publicly funded that, they're doing okay. But those private businesses, the nurseries, the in-home providers, those are the ones that really require the tuition. And as we approach this conversation, really thinking about the childcare aspect, but also the family aspect. Andrea, you're hitting on that with like the two generational approaches there, but it goes hand in hand. We can't throw all the money, at childcare centers for them to raise tuition. We have to put supports in place so that tuition is affordable for families, and the businesses can still, the childcare world can still thrive.
So I'm curious, based on all the concerns we've already shared, as the US begins to open up again, what do you hope will return to pre-pandemic conditions, and what do you hope will change?
I can speak just from kind of the the business perspective, I hope women that left who want to re-enter the workforce, re-enter the workforce. And I don't have all the statistics, but I know that studies have shown that having a diverse workforce, having women contribute does help the bottom line. So that's certainly the one thing I hope. The one thing I hope does not change is the recognition that we really do bring our whole selves to work, which means we cannot be fully present when we don't have childcare for our kids. And if we're dealing with a sick family member, and actually really respecting that and not just giving it lip service, hopefully that'll stay.
I would say, I would hope the capacity comes back. You know, those temporarily closed programs, like it would be good if we could at least start back where we were, not at a deficit in the number of programs. One area we haven't touched on yet that I hope changes is around compensation for this workforce. I mean, we're talking women as a whole, as moms, but this workforce in childcare is predominantly women as well. And in Pennsylvania, the average wage for a childcare teacher is about $10.69 an hour. This is one of the essential workforces during the pandemic. Like after those first 2 months when everybody was very unsure and everything was shut down, this is a workforce that was back to work every day and put their health, their family's health on the line, you know, to serve families and children. And they wanted to do it. But to what end? Like we need to think about when we're developing our hopeful new visionary system that includes enough funding to appropriately compensate childcare teachers for the work they do, the degrees they've achieved. Many of these teachers have a bachelor's degree just like an elementary school teacher do. We need to start having those conversations about the workforce. That is the key to having a high quality program.
Absolutely. And Jen, just to piggyback on that too, I mean, certainly this is a gender issue, like what women account for 95% of the workforce when we look at who's working in childcare, but also looking at Black and Latina women, I think 2.5 times more likely to be in the childcare workforce than in just like the overall workforce. And so, you know, pay equity is incredibly important, and it's directly tied to quality, right? Because then we have teachers that have the qualifications, but they also have the retention and providing that stable, consistent, nurturing learning environment for children.
Since we're looking at issues of inequity, a question from our audience, Dr. Moyer asks, does anyone on the panel project potential disparities in how the funding is distributed with regards to areas of high concentrations of students of color to areas with fewer students of color?
I think that's something we have to look to very closely. We as an advocacy campaign have started to collect data from the state around race and ethnicity. To look at it by geography, but also star level, so that quality rating scale, to get a sense for where there already are inequities, so that, you know, the policy that comes behind that money and the decisions that are made, you know, if we're serving more children, how is that money driven out? Where is it driven out? If we're trying to, there's a lot of work to help move our programs that haven't yet met high quality standards up to high quality. You know, where are we investing those resources so that children, you know, Black and brown children are benefiting from it as well? So I think there's the potential, but I am hopeful. I think our Office of Child Development and Early Learning is looking at race equity very closely too. And I know the Department of Human Services has issued a report around race equity recently. So I think this is top of mind for them, but it's a really great question and one we have to watch, you know, as this money is driven out.
Thank you. So if your current work involves families, what would you like the larger community to know that would support your efforts?
I can kick us off on that one. And I know Andrea, my initial response is really thinking strategic in the community. And I know Andrea, you'll bounce off of this because we're having conversations right now about it, but how do our local businesses and early childhood education and early learning, you know, come together? Because we know we're going to impact the economic recovery. We both have mutual beneficial things that we can benefit from a collaboration and a partnership. And so I think if there is a way to come together, we start having those conversations at the community level. I know I'm having those conversations in my community and thinking about like, how can we move forward and, redevelop our, make sure that women aren't leaving the workforce, employees feel supported, kids are in high quality early learning, and it's really focusing on that 2-generational approach that Andrew was hitting on. And I think ways that they can consider thinking about that is, we can look at partnering to establish on-site childcare. We can look at through EITC donations. We can look at policies that they currently have. I know the organization I work in, we're looking at how do we establish policies, because we're not going to move forward in the same way that we were pre-pandemic. And so, you could also look at how do you subsidize childcare for your employees if it's not on site, but with a partner childcare center. So I know if we can think strategically, if we can partner, support businesses with how to do that, I think that would be a good step.
Amanda, that's awesome. You definitely, hit upon some really important components when we think about the business community, who absolutely has an important role to play, right? And I think you did a great job of saying, like, yeah, there is, that very pretty significant investment of opening an on-site childcare center. But there's a variety of ways in which that can look and that can happen. But there's also so many things. And even, we talk to our business leaders at a very fundamental level. Do your HR departments know how to help your working families access quality childcare? If they are eligible for benefits, helping to pay for subsidies, like, do they know how? But there is a variety of things that businesses can do. And so even pre-pandemic, we know that the lack of affordable, accessible, quality childcare had a huge impact on Pennsylvania's economy, to the tune of $3.47 billion a year in direct employer costs and lost state tax revenue. And so, I know, because working with business leaders, when you talk about those economic impact dollars, all of a sudden they start listening a little differently, because it's affecting their bottom line, right? Like, it's good, definitely, for families and for children, but it's good for business. And so, and Jen mentioned this too, I mean, the childcare now, it's like a headline in the Wall Street Journal. Like, when did that happen before? So the time is right to think about, yes, what are these public investments? How can we be smart about it? But then how can we have this, accent of the businesses really having skin in the game when it comes to supporting their working families through childcare?
So from our work, our organization is part of a broader advocacy campaign called Start Strong PA. And the campaign is focused on building access to high quality, affordable childcare. It's, again, nonpartisan, statewide effort. And it launched in 2019. Little did we know we were going to have a pandemic that impacted our work, but we're always looking for more people to join the campaign as supporters. Follow us on social media. I can plug in our website into the chat in a minute. So how that work affects families, we directly advocate for low-income families so that more families can access that childcare subsidy that we talked about earlier. We also advocate, Amanda mentioned, like the childcare independent tax credit. We advocate at the federal level, for expansion of that credit so that childcare is more affordable to our moderate income families. So while our advocacy does focus on programs and the teachers in the field too, we definitely have a parent and child focus to our work. And we're always looking to lift up parent voice in our work. That can be as simple as, sending a note to your legislator, through our action alerts. Or if you're interested in becoming more involved, we like to bring parents to our meetings with legislators or talk to the media about your experiences. That's really important to kind of showcase what's really going on. And it has been an effective tactic in our work throughout the pandemic to really show boots on the ground what's happening for families and for programs. So
I actually have more of a question. Sorry to take over your job, Dr. Burke, but and we can put a pin in it later if it makes sense to. when you're talking about funding these programs, I guess I'm curious kind of what the breakdown is around where this money is really going to individual families in terms of credits and tax credits, or to actual like daycare centers and big programs. Because is there a gap in other types of childcare that are impacting people's ability to work? And I think about a very specific example of a woman that I used to work with who she worked during the day, her husband worked at night, right? And so that is how they tried to manage childcare, but they were also down to one car. So when he got off at work around midnight or 12:30, whatever his hours were, she had to scoop up her two young children, put them in the car, go pick him up. And they tried carpools, they tried, that is what they had to do because there wasn't any other realistic support provided to them. So in that sense, it's like what her childcare need was in that moment really wasn't going to be a full day educational program. It was just making sure her babies were safe. So is that element, or just people who work off hours and not, traditional 9-to-5 jobs, how does that play into the conversation?
Thank you for bringing up a very important aspect, that childcare doesn't necessarily have one perfect look to it. And I think you bring up a really important point. That family decided it was best for the childcare to be within the family, within the parents, but a second vehicle would have been what they would have benefited from. So looking more broadly at it, what do all of you see as the best combination of options that we could provide given the circumstances? Where do you would hope the funding would go?
So this will partly answer part of your question, Rebecca. How the subsidy works generally, and in Pennsylvania specifically, it's the parent's choice to choose a program, and then the state pays the program directly for that care. Unfortunately, what they pay does not equate to the actual cost of what it costs to provide that care. And then the parent pays a co-payment to the provider, and it's based on your family income and family size. So, and non-traditional hour care is a big problem. Whether it's second, third shift, weekend care, it's something that needs to be tackled as we move forward for our families. And, when you ask where would we want to see the money invested, I don't think there's one silver bullet, but we have to think about the system as a whole. So I would say we need to make sure families know about the subsidy program. They know about quality and why it's important, so they're well educated. I think we need to make sure the families who are eligible can access childcare. So making sure there's enough dollars for families to get access to subsidized childcare. And then we need to appropriately fund the programs. Like I said, what they're receiving to take a subsidized child doesn't equate to the cost that they're putting out. It's not paying their teachers appropriately. And that's why we have huge turnover in the field, which isn't good for kids. Kids need those permanent attachments. That's proven through brain science, that's what creates a high quality program. So I would want the system looked at as a whole. What do families need? What do programs need to run at a high quality level? And what do we need to do to retain our highly qualified teachers?
And to piggyback on that, Jen, when you think about subsidized, we're trying to keep those numbers to 7%, maybe better, Jen, of their income. And so I think once you exceed the income qualifications, you're then paying the full cost of care. And this is more prevalent in infants and toddlers because there is some gap funding for pre-K counts that can help with pre-K opportunities. But with infants and toddlers, there's nothing like that. And so once you have that, you're paying the full cost of care. And so I think we can also, when we look at the entire, you're saying look at the entire process as a whole. I think that's one of the things is that gap. And how do we go from losing a subsidy to now paying the full cost of care, which could be about 37% of your income? How do you make that jump? And Jen, you mentioned, in the very, very beginning that, it trumps your mortgage. It trumps, all these and rivals, college tuition. And so how do we prepare for that or close that gap so that cliff isn't so steep and so high?
You're on mute.
Thank you. I think we've already sort of brought this up, but just to make it a little bit more concrete for our listeners, we've all shared some of the reasons why we think access to childcare is important for the broader community. But let's just make it concrete. Why exactly do you think we need to be advocates for better childcare? Let's just leave it open-ended.
So I'll start with the benefit to the child. We know that if you haven't heard this before, your brain develops faster birth to 3, or if you want to look birth to 5, than it does at any other point in your life. So the experiences, the connections, those adults that you are interacting with are critical to your learning, and babies are born learning. So that's why, you know, I think all of us have talked about quality. You know, the teachers in childcare are getting education about what are the strategies, what's a developmentally appropriate way to care for and educate young children. And that results in, there are a lot of studies out there about high quality early education resulting in readiness for kindergarten, school success. Andrea talked about like developing the workforce of the future, developing a cohort of children who are not going to be reliant upon our public assistance systems, and being able to be independent and out on their own and contributing to the, you know, economics of our society. So I'll start there. I know others can jump in about, you know, benefits to families and the economy overall as well.
Yeah. And I'll just echo Jen. I mean, you know, and I said it before, you know, there's a huge economic impact when we don't have sufficient childcare. So think about when we do. I mean, if annually Pennsylvania is losing nearly $3.5 billion in, again, reduced absenteeism and turnover, and the costs that are, you know, affected to the employer, but also in taxes. But think about, you know, if employees had access. I mean, you have, and I think Rebecca, you said this too. There's actually a term I learned. It's called presenteeism. It's when, you know, you have parents at work or anybody at work, but you're distracted. So you're not working at like 100% of your potential. And so those are really, that is a cost to an employer too. So when we look at, you know, the benefits when families do have childcare, you know, they're more likely to show up to work and be there on time and not have to leave early and be fully present and be fully productive. And so that's going to just feed our economic engine in a very, you know, important way.
Yep. And just to add on to that, it's not just once they're there and working for us, but I want the best talent pool possible to hire from so that I have the most skilled, best quality workforce that I can get. And so it is the two parts of enabling that workforce to be available for me to hire, as well as enabling the second generation, like you'd said, Andrea, to be ready for 20 years from now.
And I think going back to like the benefits and the difference of like high quality and why we're really advocating for high quality is that we know, you know, this is the piggy off of what Jen was saying, you know, with developmental milestones. We know high quality centers they're recording more observations. They have assessments that they are following. They're meeting with the parent regularly to discuss those milestones that they're on. You know, and that all is along with kindergarten readiness, but they also are required to prove that they have gone and got their well child visits done, immunizations. So it's this educational component. The social emotional is prevalent as well, but it's also the health and well-being of the family.
Thank you. So at this point, I'd like to open it up to questions. So if anyone listening has any questions for the panelists, please put them in the Q&A feature at the bottom of the Zoom. And we have one here to kick us off. The question is about wage disparities that are impacting programs. So wages for the people providing the childcare. And as we had already brought up, majority women, predominantly Black and Brown, receive less money, particularly sometimes Dr. Moyer brought up the statistic, preschool teachers nationally earn approximately $3 more than their infant toddler counterparts. and that age range has the largest outcome ROI on a human capital. Also retention, which is an issue we've already brought up. So what ideas exist to ensure that wage equity becomes an issue and that we have that well-trained, highly skilled early childhood workforce?
So this gets back a bit to what I was saying earlier about appropriately funding the programs. Because at least on the subsidized side, if you're a highly subsidized program and between the state and federal funds that come to your program for those children are not actually paying for the cost of care, you're not going to be able to appropriately pay your teachers. And there is the disparity, you know, when you look at babies and toddlers versus pre-K, because a lot of the money pumped into pre-K is going into programs that are in our public schools. So they're going to treat those pre-K teachers as they would, you know, all of their teachers K-12. There's also been, as I mentioned, you know, Amanda mentioned earlier, we have a state pre-K counts program. We supplement funds for Head Start. Those programs, you know, they're getting a set amount of money per year that's a bit higher than when we look at what childcare programs are getting traditionally for those pre-K students, which allow for the higher wages. So contracts are one way that we're at least looking at as advocates in the childcare system of hopefully, you know, improving the stability for programs and allowing them to pay their teachers a more appropriate wage. That's one solution. There has been a movement to try to increase the minimum wage, but I will say frankly, like we would rather see teachers paid based on their educational attainment and experience. Like we think they're, you know, yes, certainly deserving of the minimum wage, but it goes beyond that. You know, these are, like, as I said, a lot of these people are teachers just like in the K-12 system. So that the contracting is one idea that we've been tossing around.
Yeah, and I think it's really interesting when we think about the role that higher ed can play as well. There was a blog, I think it came out this morning in the Chronicle of Higher Ed, and you know, what is it? 1 in 5 undergraduate students is a parent. And some of those are, you know, parents of very young children. And so we think about, you know, how colleges and universities can kind of help support the childcare needs of their students and also their employees. And then on the flip side, they're also the educators, right? You know, Millersville, the early education program is phenomenal. And we need, you know, kind of this combination of efforts when we're having these federal dollars to help fund the programs appropriately. So when graduates, you know, can have a like living, successful career in early childhood education. So I think it's going to be really interesting to see the way that higher ed can play an important role in this conversation.
Good point.
Well, thank you for the compliment for Millersville. And also, I think it's important that we call things out for what they are. And there's a stigma. There's a stigma attached to infant and toddler care. It's seen as a gendered skill that women should just possess. And so people don't necessarily feel like that should be equitably paid for because women should just be able to do it. It shouldn't require training. They should just have the skill. But I think you're absolutely right that there's training that's involved to become a master at it, and individuals are getting that training and then they're not being compensated accordingly. So thank you for this discussion.
So I just want to jump in there because, you know, I was a director of a NACCE accredited childcare center for primarily parents who worked at Franklin and Marshall College and Penn Medicine, Lancaster General Health. And I, you know, can so well remember giving the tours to the center and in the infant room, looking at the daily schedule and how it's based on curriculum and how that curriculum is aligned to the Pennsylvania Early Learning Standards, right? And then we would go into the young toddlers and, oh, look how, you know, the infant curriculum builds upon the infants and toddlers and so on and so on. And so I think so much of it, like you said, Dr. Burke, is like education and awareness and understanding that the developmental period for infants is incredible. And when there's that intentional interaction and nurturing, I mean, you are just really setting a child up for success at the youngest age.
Yeah. And piggyback, like Amanda talked about this, there's other components that are very similar to K-12. They're doing the parent-teacher, we call them the parent-teacher conferences in K-12, but they're doing it in a high-quality program almost every day. I got report from my children every day about what they did, what they ate, you know, were there any issues that day I should know about as I'm going home? If the family's in need of other social services, they're helping linking them to those things, identifying potential, like, you know, need for early intervention services and developmental delays or potential other issues a child's experiencing. So, you know, there's the regular education, and then everything that goes beyond it, that, you know, almost in some ways, sometimes borders social, like helping with social services with families. So I'm hopeful we can get to a place where our early educators are thought of in the same light as, you know, K through 12 and beyond.
Yeah,
It gets to Rebecca's point on the culture earlier.
Yeah, and some of these, I think, answers or responses are tied to long-term plans or things that are going to take a lot of time. I think what we can do immediately, though, is really coming back to some of these partnerships, so that, because the only way that we're going to increase wages and salaries is increasing tuition, and that's what we want to avoid. And so I think we have to think about what are some of the short-term things that we can do by partnering with businesses, donations and things like that, as well as like some of these long-term things that you're talking about, Jen, as well. Because if we can keep, you know, space costs down or other costs down for centers, we can also then, you know, increase wages in our budgets other places. But yeah, I think we need to have a long-term plan, because our infant toddler, I mean, I have an infant already, and I know how valuable, you know, she is to the education of my child, especially in those first 3 years. And so it's definitely very, very important.
Yeah, I was just going to say, Jen, you know, one could argue that K through 12 teachers aren't paid commensurate, you know, with their years of experience either,
Right.
so it might be an even bigger issue. But that made me think of a comment that was earlier about what the true cost of childcare is, and perhaps that tuition doesn't have to be as expensive as is, or was it the reverse, that actually it costs much more to run these programs than we're realizing? It's the reverse, right?
More. Yeah.
Yeah. I have more questions, but I'll be quiet because I'm supposed to be panelist.
Go ahead. What's your next question?
No, I was just thinking about how a lot of childcare plays out here in San Francisco, and this might be more similar to other larger cities as well. For a variety of reasons, you have transplants, so you don't have any type of other family or very limited community support. As I mentioned, supply and demand, the demand far exceeds the supply of childcare centers, and many of them are already contracted to either government employees or specific businesses. So if you're not a part of those, a lot of people go to nannies and also nanny shares. Predominantly, they're almost all women, and mostly women of color. And then there's also, of course, the au pair network as well. So given how important early childhood development is, what type of support do you envision, or do you know is available for families who, for a variety of reasons, feel they need to go the nanny or the nanny share route to ensure that they also are able to give their children quality childcare? There's a lot of wonderful nannies out there, so I don't want it to make it seem like they're not experienced and loving and nurturing and able to provide this. But how is there any type of level of checks and balances on that type of childcare?
To my knowledge, as far as if you're thinking about like health and safety and inspection, that really doesn't exist. If you're caring for 3 or fewer, like if you're a relative, there's no requirement for an inspection unless you get above that threshold of 3 children. Family childcare that's offered in the home is inspected annually in Pennsylvania. But you seem to be talking more about situations where, you know, the nanny or caregiver is coming to the parent's home. So that would take a lot of additional funding and oversight from the state inspection pot to be able to do something like that. And I'm not that familiar with that network in Pennsylvania. I don't know if Andrea or Amanda are.
The only thing that I will add as like a different resource instead of, for nannies or other, moms that are staying home or dads that are staying home is thinking about, through one of our collective impact grants is called P3 Partnership Pathways in Lancaster County. And so this is alignment of, prenatal all the way through early elementary grades. And like, how do we partner with in early childhood with our K-12 partners? Because a lot of the questions that we were having in the county was where are the children, and those children who are staying home, how do we reach them? How do we connect them to our K-12, so that they feel connected to our community? And so right now in Lancaster County, we're exploring through our funding through the Collective Impact Grant is how do we implement play and learn groups. And so these are research-based and aligned with, how do we give them educational components, and there's certain criteria that makes this kind of like, we know there has to be certain components that exist, and that could be educational pieces, parent involvement, engagement, parent leadership, and how do we do that effectively so that those who don't want to choose to put their children in care also are being able to attend, an experience that could give them, opportunities to either build their social capital, connect to their, local school, and as well as, learn about developmental milestones. So that's one thing that we're implementing as like a strategy in our county.
That sounds really powerful, Amanda. So thank you for sharing about that opportunity and that grant, because that sounds very much like something that could benefit potentially nannies or au pairs if they wanted to learn and to grow. Then perhaps that could be a solution. Because I do think this childcare issue is multi-level. It impacts all economic factors of our society. It impacts all races. Children are our future, and we need to invest in them. So I think this is a really important discussion, and I thank you all for your robust contributions. I think we only have a few more minutes. So are there any last closing important thoughts that we should get out?
I guess I'll just jump in. I think we probably all will echo, but the timing of this conversation is just incredibly relevant. And so, Jen gave some really good sources for people to advocate, to have their voices heard. I think that we just really need to continue to elevate this conversation. Again, we know even at the federal level, we're hearing talks about expanding, the K through 12 to include, 3 and 4-year-olds, in public education. But we can't forget about the infants and toddlers then as well. So, I just think continuing to have this conversation and just reminding and educating folks that quality childcare is quality early learning, and it is a 2-generation workforce issue.
Well said. I really just think we need, a lot of us have mentioned we're moms ourselves. So we experience it every day. The presenteeism is not something I've heard before, but I get that, I dealt with that yesterday. I just think as we're all coming out of the pandemic, we all need to be advocates. And that's why we want to, like I said, we want to have parent voice in our work. Because if you're not sharing how you feel, if you're not sharing what would benefit you as a parent, what would benefit your child, things won't change. So, we saw the power of what happened when advocates across the country, pushed for that investment in childcare to get through the pandemic. After that, I do think it's possible to kind of build a better system beyond, but we all have to work together. So again, just as Andrea said, we would love to have more people join us in our Start Strong PA campaign. Encourage you to check that website out.
So I guess one last final tiny question. If we're trying to be advocates in our local sphere of influence, is there a spot where we can find the best access? I know that we have this one for PA, but does anyone know of any other resources that we can share? Maybe that's something we can all continue to work on. I'm thinking about how to pull information that could impact locally, businesses, and as you shared before, Andrea, we need to advocate to businesses and speak in their language to make sure that they understand. And looking at this issue historically, when you look at how childcare and elementary education evolved, it took a lot of advocating, and it was largely work done by a lot of women. Abigail Adams Elliott, lots of people I teach my Urge 110 Intro to Education students about. So I think there's a rich history of advocates doing this work. So I think we all need to pull together and be those advocates. So I thank you all for being a part of this panel today. And hopefully we're all a little bit inspired to go out there and advocate a bit for childcare. So thank you.
Thank you.
Welcome. Thank you very much for having us.
Yes, thank you, everyone. Thank you especially to Dr. Burke for moderating this event. I'm just going to put a quick evaluation in the chat. We'd love to hear from everyone, just their thoughts on this conversation and the webinar series as a whole. And then also we have a spot you can add your suggestions of what do you want to talk about in upcoming events for next year as well, of what are conversations that are important that we should be elevating during this time. And then my last little plug is for our annual conference that is coming up April 14th to 16th. I'm also adding the registration into the chat there. It is a free virtual kind of webinar format of a conference. And we will be having conversations around social justice relating to all different professions, all different areas of life. Our topic is global citizenship. So really looking at how we can bring differences together. But yeah, thank you to everyone, our panelists as well. We're happy to have you join and partner with us.
Thank you.
Thank you.
Thank you.